I'm Steve Adubato. It is our pleasure to welcome here on the set Bonnie Eggenburg, who is Vice President, Gateway Early Head Start and Head Start Program. Good to see you, Bonnie.
Good morning.
We're talking oral health. We're talking about the fact that there are a whole range of children, particularly in a certain part of the state of New Jersey, that are struggling when it comes to their oral health. Talk about them.
We at Head Start identified that there were a lot of children not seeing the dentist, a lot of children suffering from caries, which is what causes cavities.
Caries?
Caries. It's the bacteria that causes the cavities in children's teeth, and we knew that we needed to do a better job of connecting with those children. A lot of parents, particularly the low-income families that we serve, don't have transportation, and a lot of them in our area, particularly Cumberland, Cape May, and Atlantic County, live in very, very rural areas, so to get to a dentist on a regular basis is quite difficult. So about almost 20 years ago, we founded the Toothmobile, and that goes out to our Head Start centers as well as various school districts in Cumberland County to make sure that children are seeing a dentist at least once a year and get follow-up services.
That's a great look at it. So I'm sorry for interrupting. That Toothmobile, what goes on inside it?
Okay. We have a very highly qualified dentist that comes in along with the dental hygienist, and they do the x-rays, they clean the teeth, and if the children need follow-up services, they get fillings. It's really the whole range of what you would experience at a dental office, except that it's in an RV.
Bonnie, talk about what happens. I mean, our friends at the Horizon Foundation, who are very big supporters of what you're doing, provided a grant, if I'm not mistaken, to help these children. We've talked to some of them, and they're medical experts, and what they've told us is that there are real long-term issues if children do not get the oral health that they need early on. Absolutely.
It affects nutrition, because if your mouth is tender, you're not going to be able to eat a wide variety of foods. It affects learning, because if you're not getting sleep because you're in pain, if you're in pain in school, you're not going to be able to function well. I can tell you a particular case that we had in our own Head Start program. We had two little boys who enrolled, and when they went to the dentist through our program, it was identified that out of the 26 teeth they had, 25 of them had cavities. We actually had to send them to a specialist so that they could see an anesthesiologist to get all of the work done. But can you imagine all of those cavities and how it affected their overall well-being every day? And that, in turn, then affects their ability to learn.
The other piece of this, which, you know, is for those of us who are parents with small children, the challenge of getting children to brush their teeth properly. I'm not overstating it, am I?
No, no. Part of what Head Start does is we brush teeth every day at school. During February, we get donations from Colgate, and we're able to send toothbrushes home. Yes, that's part of their daily routine, to brush their teeth after breakfast and then again after lunch. And we start with them as babies. We use the little cotton swabbing material to clean their teeth and gums. And then as they become toddlers, they have a special little toddler toothbrush that they use. And then as they enter preschool, then they start to use a regular toothbrush.
Talk to me about this. People often get confused or have misinformation about when a child should begin to see a dentist. When should they?
Well, for many years it was starting at age 1, but just recently the requirements in New Jersey for Medicaid has changed, and they are recommending that children are seen by a dentist even as early as the first few months of life.
Is that right?
Because caries can be passed on from the mom to the child.
The disease?
The disease. So the child, even before they have teeth, the bacteria is already in their mouth. So what you want to do is to make sure that the gums are being properly cared for, so as the teeth do erupt, that they're not being affected by caries.
Talk to us about the future of this Toothmobile. You certainly face any challenges, or you're looking to do certain things? What's going on with it?
Well, wonderfully, we received the Horizon Foundation grant, and what that was able to do for us is to replace our generator, get a lot of work done on it, because it's 20 years old. But we are actually continuing to provide services in Cumberland, Salem, and Gloucester County through the Toothmobile, and we are now working on an additional partnership where we're going to be eventually replacing that with our Wellness on Wheels partnership through Inspira and Complete Care and Gateway to not only offer the dental services, but also some physician services as well.
Last question. The counties you're talking about, name them again.
Cumberland, Gloucester, and Salem.
For those in the state and in the region who don't really know those counties in the southern part of the state, what are they facing?
It's a very rural area. Cumberland County is the lowest ranked county for child outcomes in the state. So they are struggling. They're struggling with learning. Literacy is a huge issue in Cumberland County. It's very rural, but the few urban areas that there is an extremely high crime rate as well. So there's a lot of struggles there, and Gateway has been working in a variety of ways to try and address them.
Bottom line, what do you hope for all of these children?
Bottom line, I hope that we have given them a foundation so that as they leave us, they've got the skills, the overall good health, the overall foundation for school readiness so that they can succeed later in life.
Bonnie, thank you and all of your colleagues at Head Start for everything you do every day.
Thank you.
For the children of this nation. Thank you.
Thank you. Appreciate it.
Stay with us. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Felician University, Horizon Blue Cross Blue Shield of New Jersey, the law firm of Gibbons PC, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, the North Ward Center, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.